This is Hal Sessions. I apologize for the other day not being able to record this first lecture. So I'm sitting at home today on a Friday morning. It's raining outside. There's not much else to do, so I thought I would record it again in the comfort of my living room and then post it for you, for several of you who missed it because you weren't even in the class yet, and otherwise for anybody who wants to review it. So here we go. I hope you find this helpful. We'll get it up as soon as we can. I always show this picture of a class that I had a few years ago, back in 12, it looks like. And I thought they were an amazing class because of the way they worked together. They teamed up, they formed study groups, they would reserve every study group. Actually, what they would do is they would reserve study rooms over in the library. One person would reserve it from 8 to 10, and one would reserve it from 10 to 12, and one would do it from 12 to 2. And they would book the study room for the whole day for their whole class. And a bunch of them would get in there, and they would use the whiteboard and use their computers and so forth, and really study A&P. And I think when they all left, they had a great knowledge of what they were trying to do. And I think many of them nursing students. A couple of them I know have graduated with degrees from either nursing school. There's a couple dental hygienists in there. There's a paramedic in there. Several others. A lot of them I don't have all of their follow-up. But anyway, I think the way to learn this material is to learn it together. I think we all do better when we work together, and I hope you guys will do the same. Take a look at this. You don't have to take notes. Well, the key word in that video is, and if I could teach you anything in this class, far more, far more important than teaching you muscles and nerves and physiology would be teaching you all empathy. We went through the role the other day, and I asked what each of you wanted to do, and every single one of you told me you wanted to go into some healthcare field. And, in no other field is empathy more important, because we have to treat everybody the same and offer them the best that we can offer them. But I think the same thing goes in our class, and I think if we wanted to get personal about it, we could go around the room, and every single one of you has gone through one of the experiences that you saw in that video. And some of you are probably going through some of those experiences right now, and some of you will go through them either for yourself or for a family member between now and the end of the term. Let's all be nice to each other. Let's always put ourselves in other people's shoes, and let's certainly be empathetic with each other, including me. Please be empathetic with me, because I promise you I'm going to do my best, and I hope you will do the same. Many of you probably had the Magic School Bus when you were in elementary school or middle school, and that's kind of what this course is going to be like. I'm no Ms. Frizzle, but I'm going to drive the bus, and we're going to go through the different systems of the body, a little more detail than she did, but nonetheless, it's the same thing. This is another class from just recently that has also gone on to do good things and are in the schools of their dreams, many of them right now as well. I guess the point I would make is that, our job here at PCC is not to teach you anatomy and physiology. Our job is to help you get to the school of your dreams. Not one of you wants to become an anatomist or a physiologist that I know of. At least nobody said that. So I think our job is to help you go forward with your career, and anything I can do, as long as I'm here at PCC, which I think will be a few more years, please let me know. I'll be here. So we start the course off with an x-ray, and I just ask people, what all do you see? I think, there's a heart, there's two lungs, there's a shoulder blades, which are out here to the side because of the way you hold your shoulders when you get your x-ray taken. You've got clavicles, collarbones right here. You can see all the vertebral bones. This little dark spot down here I usually ask about. I don't think I did the other day, but basically that's air in the stomach. That is an impending belch. So we've done most of these things already. We're going to cover chapter 1 before this hour is over. This is the book. This is actually the 9th edition, and we've moved on now to the 10th edition, although I would tell you there's almost no difference between the 9th and the 10th. If you're short on cash, get an older edition. They drop off in value a lot, and there's very little difference in them. I think because we augment the book with so much stuff online in this class, I think you'll be just fine. I actually teach out of the black edition, which is the 8th edition before this one. So things are changing, but they're not changing that much in this field. I do want you to use your book, because I think the book has a lot of really wonderful things. This is not a book you sit down and read from cover to cover like a novel. I remember when I first started teaching out here at PCC, and I needed to review these chapters before I taught them. So I read the book from cover to cover, and I would usually do it on the treadmill at my exercise club. And I found if I could get through like 4 pages in an hour, that was pretty good. And obviously I know the words, but it's very technical. You have to kind of think about it. It continually tells you to stop and look at the figures. Every time it says, see figure 9/2, You got to stop and look at it and read it and understand it. Otherwise, things won't make sense at all to you very quickly. There's a bunch of checkpoint questions as you go through the book. Stop and read them, answer them. If you don't know the answers to those questions, you ought to go back and review. You ought to check the answers. They're all in the back of the book, and so forth. I would put special emphasis on the clinical notes. There are little clinical notes in the book that refer to different clinical syndromes that people get, different illnesses and different problems, and it explains them on an anatomic basis or a physiologic basis. I think those are great for test questions, and I always ask questions about the clinical notes. So please don't skip those over, thinking that's not really physiology, that's sickness, because they're very key. And I think they'll also bring this subject to life more. At the end of every chapter, there's a bunch of review materials. Take your time, go through that, answer it. I don't have you turn in any homework in this class, but I still would suggest you probably do those questions for yourself. Once again, the answers are available in the back of the book. This is a student access code card. If you bought the whole book package, you got this. It gives you access to their online material, which is called Mastering A&P, for a year. And it's very good. It's excellent stuff. Most of the students who come back and talk to my new classes always say that they use this a lot. It has a lot of little practice things in it, and I think they're very valuable. So if you don't have the access, you can get it, or you can certainly borrow it from a friend, although I didn't say that. But I think the more practice you get at this stuff, the more times you say these words, the deeper it will embed down in your brain. The PhysioX is very important. If you have PhysioX 9, that's good. If you don't have it, Melissa can get a copy for you. Melissa is the main person in the lab here that is more than helpful. You'll love her, and you will find her to be probably the most valuable asset you have in A&P. I introduced her to the class, and you all need to meet her and go to Open Lab sometime. But anyway, PhysioX, let me just talk about them because students always hate them, but I think they're very valuable. Let me just relate why I think they're so valuable. When I was in medical school, I took physiology, and every week we had 3 physiology labs. And every day when we would walk into physiology lab, there was 25 dogs that had been put asleep by the technicians, intubated, were hooked up to ventilator machines. They had already been shaved. Their whole tummy and chest was shaved. They were tied, spread eagle, on an operating table. And we walked in, and then we proceeded to do things to them. We put arterial lines in. We put venous lines in. We measured CVPs. We measured intrapleural pressures. We measured oxygen levels. We measured urine output. You name it. We did it to those dogs. We also gave those dogs all kinds of different drugs to see how they affected the dog. We wrote our little notes down. The problem was, by the end of the 4 hours of lab, about half of the dogs were already dead because some guys had goofed up or they had intentionally given them too much of this drug or that drug, thinking they would get out of the rest of the lab. But at the end of the lab, whether your dog had died before that point or not, a guy with a big green syringe came around and gave every dog a shot of potassium chloride, which would stop their heart. Potassium chloride is the same drug that the state of Oregon uses down in the execution chamber at the Salem prison to stop people's hearts when we use the death penalty, which hasn't happened in a number of years. But nonetheless, that's the drug used in all executions. Well, the problem is then after that, we would untie the dogs and pull all the lines out, and a guy with a big wheelbarrow would roll around the room, and everybody would flip their dead dog carcass off into this wheelbarrow, and he would take them out, throw them in a truck, and they would eventually go to the dump. Well, that's 25 dogs 3 times a week. That's 75 dogs a week. That's a lot of dogs. But of course, Memphis, Tennessee, which is where I went to medical school, they had plenty of stray dogs, and they didn't consider that a problem back in 1974 and 5. But I will tell you that would not happen today. We think more of animals and dogs than that. I have shelter animals myself. So that's not going to happen. So what we've moved to is this dry lab or computer-based physiology experiments, and that's what we do in the PhysioX. So they don't take that long. They are somewhat redundant. They are easy to work your way through. But the points that they teach, I think, are very important. So please do not ignore your PhysioXs. I promise you that I will have them on the practical exams. There will be a number of questions from the PhysioXs. This is an old lab book. I think we're now up to the 12th one. They change a lot. Just be sure that you have the CAT edition, whichever lab book you have. And I don't think if you have one that's, probably either the 7th, 8th, 9th, 10th, 11th, or 12th, I think they're all close enough that they would work just fine for you. I do not require you to turn in any paperwork after a lab. I just expect you to learn the material. This is college, folks. Here's a later one. Here's the 10th edition. This is a picture of me in my thinner days when I was a little more flexible. I'm just kidding you. I have never in my life been able to bend my head over and touch my knees like this guy is. That's incredible, isn't it? So anyway, that's the manual. It's by Mareeb and Mitchell. As far as additional supplies are concerned, I have this slide in here with dissecting kits. But I'll be honest with you, I don't think you need to buy any dissecting kits. It's nice to have one just because they have nice new instruments and they're not all rusty and crappy looking. But you don't have to. We have a whole lot here in the lab that we're happy for you to use. You will need some Scantrons for the 3 big tests. They need to be the kind that have 50 questions on each side because all the tests have 100 questions. If you were going to buy anything else, I would buy this disc right here. It's called Anatomy and Physiology Revealed. This is the 2.0, but there's now a 3.0 and maybe even a 4.0. But it comes from McGraw-Hill textbook. We don't use McGraw-Hill, so you don't automatically get it. But I would just say that it's an excellent tool. And if you want to go in with a buddy or two, I think they're about $60. I will use this disc a lot in class. I will play you a lot of videos out of it and show you things out of it that I think are very helpful. So it's not required by any means. It's one more thing. And I think one of the problems that we have in A&P is we just blow too much stuff at you for you to use it all. But this is a good one if you have the resources. Couple study strategies that I try to give you. You just got to come to class. You got to come to lab. You'll hear so much. You'll learn so much from your buddies that it's just really very valuable, if I do say so myself. Read the lecture. Read the assignments before you come to class. They'll mean a whole lot more to you if you have read through it. This is not a class you can study for just prior to the exams. You'll need to study for it probably every day if you're going to do really well in it. Don't put things off. And another comment there is to approach the information in different ways. And I think one of the best ways is to teach each other. If you sit there with a model and one person has a pipe cleaner and points to different things, and he has the answer sheet there in front of him and asks you, what's this, what's this, what's that? You think you'll find that helpful. There's also things on the internet, and there's things on D2L, and there's things on Rock Creek Bio Group that are sort of practice things like that as well. Every time you say these words, you also hear these words. If you can say them properly and if you can hear them properly, you can probably spell them properly. Now, I don't grade on spelling very much. As long as you're close, you'll probably get credit, but you got to be pretty close. We'll give a quiz every week. Well, not every week, but pretty much. We'll give 7 or 8 of them. And basically, you get to throw one of them out, and altogether they'll be worth 100 points. The quizzes will be, sometimes they'll be written out, and I'll just hand them to you, and you do them, and we take about 10 minutes to do them. Sometimes I put them, flash up slides on the board and ask you questions, and we go through them like that. I will always tell you what day of the week the quizzes are going to be on. If you watch your news feeds that are on D2L, it'll tell you. Not only will it tell you what day it is, but it'll tell you exactly what it's going to cover. I'm not here to trick anybody. All right, let's start in Chapter 1, Anatomy and Physiology. Anatomy is the oldest science. It started way back when. People had, when people died, there was bodies, and when there was wars, there was people cut open, and people started looking at those things cut open and started trying to identify those things, and they did. They came up with names for things. The problem is they didn't know how any of them worked. In fact, it wasn't until very late that somebody figured out that actually the heart was a pump, and it pumped blood around through these pipes called arteries and veins. And if you can imagine, if you didn't even know that the heart was pumping blood around, how much did you really understand about anything? And that was a late happening, occurred late in the 1500s, I believe. Anyway, so anatomy is the oldest science, but it was pretty crude, and it was also difficult for a couple of reasons. Number one, they didn't have iPhones, so when they dissected something, they couldn't just take a picture of it and put it on the internet and show it to all their friends. And because of that, anatomy really arose out of the artists and the Leonardo da Vinci's and the Michelangelos of the world. A lot of what they did was document anatomy. So you've seen all these diagrams and drawings, woodcuts, done by Michelangelo and done by Leonardo da Vinci that show anatomic structures. Well, you also got to remember that dealing with bodies was wasn't very popular with the Catholic Church, and they were very controlling in Europe for most of the Dark Ages and even into the Renaissance. And so most of this study was done by digging up bodies after they were buried. They'd dig them up, take them to their lab. They'd all get together there in the middle of the night and dissect this body. And then before the sun came up, they would take it back and bury it again. So they didn't have preservatives. They didn't have the formalin and so forth that we do that keep these things from rotting. And you can imagine how quickly they rotted and how badly they smelled. So it truly was an act of love and just pure educational interest that got this stuff all worked out to start with. So physiology, on the other hand, is the study of how things function. And that's where really all the big advances have been made in the last 50 or 60 years. I went to medical school in the 70s, and I can tell you that our physiology book was so trivial compared to what's known now about all of these processes, because we didn't understand enzymes very well. We didn't understand so many of the chemicals that go on. We didn't understand nerve transmission near as well as we do now. So physiology has really made great advances. We didn't know really hardly anything about genetics back then. We knew basic Mendelian genetics, but certainly nothing about the genes, the human genome, and so forth. So physiology involves a lot of stuff, including biochemistry, biology. Anatomy, therefore, just for definition purposes, describes the structures of the body, what they're made of, where they're located, what they're associated with. Physiology is how do they function, how do they work, how do they cooperate to make things happen. You can split things up, if you like. Gross anatomy is referred to as macroscopic anatomy. In other words, it's stuff that you don't have to see through a microscope. It's stuff you can see with your eyes. Surface anatomy refers to the things you can see from the surface. We'll talk about the regions in a few minutes. Regional anatomy deals with body areas. Now, I will tell you that when I went to medical school, we learned anatomy on a regional basis. And what that meant was we dissected the arm. Actually, we dissected the back first. And we dissected out the skin, and we dissected out the fat, and we dissected out all the nerves and the muscles and all that stuff on the back. Then we flipped our cadavers over, and we studied the arm, and we learned everything about the arm. And then eventually we got to the chest and the abdomen and the legs and so forth. So we did it region by region, and that's the way a lot of schools still teach anatomy. And it makes sense, I guess, if you're dissecting cadavers, because that way they get completely dissected. On the other hand, the way we teach it in this class is systemically. In other words, we start with an introductory chapter here. We do chapter 4 next, and that's an introduction to the histology of the different tissues. But it's just an introduction. And then we start going through system by system. And the next one we do is the skin. The next one we do is the bones. The next one we do is the muscles. The next one we do is the nervous system. And then we work through all the other systems as we go through 232 and 233. So we study it from a systemic nature. And we also try to learn how those different organs work together to make that happen. Now, developmental anatomy, oftentimes called embryology or developmental anatomy, is how we go from this one fertilized egg, and it starts dividing into 2 cells, and then 4 cells, and then 8 cells, and 16. And eventually, when it gets up to several hundred, those cells start to differentiate and become different looking from each other. And eventually, out of that ball of cells, we end up with the different structures and the different organs. So the study of how that all happens is an early thing that happens very, very, very early in our development. In fact, we're pretty much completely developed. At least all of our organs are present by the 12th week of gestation, which is actually before some women even know they're pregnant. Nonetheless, that's developmental anatomy. The last chapter in our A&P book is on developmental anatomy. So after you know how it's all supposed to be put together, we'll spend the final chapter talking about how it developed and turned into what we ended up with. Microscopic anatomy is stuff you look at through a microscope. It involves the cells and the tissues of the body. You need to understand the difference between cytology and histology. Cytology is the study of cells that are just kind of loose cells floating around. And a lot of looking at blood is cytology. You're just looking at different cells. But also, the best example of cytology is probably the Pap smear. The Pap smear is where you take a lady and lay her on the exam table, and you put in this device from the Middle Ages called a speculum, so that you could look at the cervix. Then you take a popsicle stick and kind of scrape around the cervix of the uterus, and you scrape off a few cells. You don't really see anything. You smear it out on a slide, you spray it with hairspray, and then you send it off to the cytology lab for somebody to look at those cells. Now, they're just looking at single cells, and they look at them and they say, oh, these look fine, these look inflamed, these look like they're working towards cancer, or these look like cancer cells. So it's simply a screening test done looking at loose cells. That's what cytology is. Histology, on the other hand, is when you look at a piece of tissue. And so if you do a biopsy, take a little slice out of a lump in lady's breast, you send that to the lab, and they freeze it, and they cut it up, and they look at it right away, and they also stain it and look at it under the microscope in several days. But that's histology. So histology looks at tissues, a whole lump of tissue, because that piece of breast tissue will not only have breast tissue in it, but it'll also have blood vessels, and it'll have nerves, and it'll have lymph things and lymph nodes and so forth. So histology is really what we're going to learn here in A&P. Physiology can be split up as well. Cell physiology is we'll study a fair amount of. That's how the things work within the cells and between the cells. That's why you need to go back and review Chapter 3, especially if you didn't take 112 just last term. You probably better go back and reread it. I have posted lectures for Chapter 2, which is on the chemistry of life, and Chapter 3, which is the physiology and study of cells, but we will not lecture on those in this class. That's presumed to be a prerequisite that you've already studied. My experience has been that students don't remember it very well, and so I went over and filmed the lectures so that you can re-watch them and get yourself brought back up to speed on that stuff. Special physiology deals with the special organs, things like your eyeball, and how you see, your ear and how you hear, your taste buds and how you taste, and so forth. Systemic physiology deals with the functions of an organ system. And since we study this anatomy and physiology from a systemic point of view, you will find that we study it like that. So you can't just study the heart by itself. You kind of have to study the heart along with the blood, along with the blood vessels and how it circulates around and so forth. Pathologic physiology, anytime you see pathology, that refers to disease. So we don't study a lot of pathologic physiology here, but I think if you don't understand the physiology of how things are supposed to work, it's pretty impossible to understand how they get sick and maybe how they heal or how you die from it. So A&P is very important. If you don't take pathophysiology here, actually it's the other course that I teach at PCC. I teach it online. It's called Pathophysiology Biology 241 that you're welcome to take. It's not required for hardly any schools anymore, but I think students tend to enjoy it. It's online. It's only 3 hours, and it'll give you a heads up. Otherwise, when you go to nursing school, you'll take a 2-term course of pathophysiology and so forth. Most all the schools will have the study of pathophysiology in their curriculum. So if we wanted to just kind of start and talk about things called levels of organization, I think you need to understand this. Obviously, atoms are the smallest organizational level, and everything is made up of atoms. Atoms form together to form molecules, and molecules form together to form cells. So we study the chemical level in Chapter 2, we study the cellular level in Chapter 3, and then we get to the tissue level, which is in Chapter 4. Now, remember, we are not going to lecture on Chapters 2 and 3, but I have stuff up there online for you that will help you with that. I will test on it. Chapter 2 will be covered on the first quiz. Chapter 3 will be covered on the second quiz, along with some other stuff. Once you get tissues, then you put tissues together and they form organs. Organs are a number of tissues that are working together. And once you got organs, then you hook organs together and they become organ systems. So all these little pictures across the middle of this slide are the different organ systems. And you can see integumentary is the skin, skeletal is the bones, muscular, and nervous. Those are the 4 that we cover in 231. And then we go on and learn endocrine, cardiovascular, lymphoid, respiratory. Actually, it ends at lymphoid. That's the end of 232. And then 233 involves respiratory, digestive, urinary, and reproductive. and then also that developmental chapter that I talked about at the very end. So if you follow this schematic starting at the bottom, you see it starts with atoms, form complex molecules like proteins, form cells like a heart muscle cell illustrated there. Here's a cardiac muscle cell, what it looks like under the microscope. A bunch of these things go together to form a heart. A heart forms with other things to form the cardiovascular system. I think at this point you ought to flip through the different this part of the chapter, and you ought to basically know what organs belong to what system. And some of them, unfortunately, belong to two systems at the same time. Let's go farther than that. If you put a bunch of organ systems together, you have a person or an organism. You put a bunch of organisms that live together in the same place, and they become a population. You add all the other species together, and you form a community. And that involves, all the birds and the bees and the insects and the germs and everything. Forms a community. And then you add in the non-living things, which basically involves the environment, the sun, the temperature, the humidity, the rainfall, and so forth. And now you have a complete ecosystem. Ecosystem can be the size of a box and be a terrarium or something like that, or it can be as large as a mountain range. However, the largest system on Earth is the biosphere, and that refers to the entire Earth and everything within our atmosphere. Now, you guys may not know this, but this is actually the most famous and most widely duplicated picture in the history of the world. Not that one, but this one. And this, you may not even remember when this was taken, but I can assure you that I did, because I was a freshman in college, and I was home for winter break, and we were sitting around watching Huntley Brinkley on the news, because we had just we were doing a space shot, the United States was, and for the first time, man left the orbit of Earth. So, just to recall, teach you a little history here. In 1961, President Kennedy, in a State of the Union message, I believe, went on TV and said that we're going to put a man on the moon by the end of the decade. We're going to do it not because it's easy, but because it's hard. And we're a country that solves hard problems and does cool things, basically. We're going to send the man to the Earth, to the moon, and bring him back alive and healthy. And that's indeed what happened. So this was, we had some accidents and some people died, and that slowed the space program down. But we went through the first program, which was the Mercury program. It only had one astronaut in it at a time. And of course, Alan Shepard was the first one, and John Glenn was the first one to orbit the Earth. So Alan Shepard and Gus Grissom both were just shot out into the Atlantic, but they went up into space. That was the first space shots by America. Russia was way ahead of us at this point. They were already orbiting the Earth with their cosmonauts. And then we went to the Gemini program, which involved two astronauts in it at a time. And they started going up into orbit and staying up there for a week or two. They started doing spacewalks. They started doing rendezvous in space. And they started docking spaceships in space. All of these were steps in order to get ready to send a man to the moon. And then the Apollo program began. The Apollo program had 3 astronauts in each capsule. And so the Apollo, they shot a couple of guys up that just orbited the Earth, but then along came Apollo 8, which was this shot right here. And this was the first time that man had ever left orbit of the Earth. So this was the very first time that a man had ever been more than 300 miles from the surface of the Earth. So we shot this. This time they went up and they circled around the moon a few times and they came back. They did not land. But I will never forget, because it happened on Christmas Eve, that they actually arrived at the moon and they went into orbit around the moon. And I remember the news broadcast of them. And I remember that Huntley Brinkley said, now they're gonna go around the back of the moon, and they're gonna go to the dark side of the moon. And Pink Floyd thought about that and jumped on that and wrote a song, I guess. But the fact was, we didn't know what was on the backside of the moon because we had never seen the backside of the moon. The same side of the moon always faces Earth. So they went around the back of the moon, and one of the astronauts was sitting there, and they were out of radio contact. And they said, well, they're going to be out of radio contact for 15 minutes, I think. And 15, 16, 17, 18 minutes went by, and we didn't hear from them. We thought, oh, my God, they've hit a wall on the back of the moon. We didn't know it was there or something. But eventually they came back into contact, and they commented on what a beautiful sight it was to see the Earth again. One guy whipped out his Hasselblad camera and took this picture. And for the first time ever, man had seen Earth from away from Earth. And suddenly there was this great realization by, I guess, billions of people on Earth that, hey, you know what? That's all we got right there. That's the Earth. That's its atmosphere. Those are the clouds. That's the water. That's the land. We better take care of it. And so within that very first year, this was, by the way, this was December the 24th, 1968, that this picture was taken. And within the next year, we passed the Environmental Protection Agency. We passed the Clean Water Act. We passed the Clean Air Act. The EPA was formed, if I didn't say that. We had the first Earth Day in 1970, and the entire ecological movement in the world started basically, I think, due to this picture of our Mother Earth there for the first time ever. Of course, that's the moon down there at the bottom. And this picture is referred to as Earthrise. Anyway, so that's the biosphere. Let's go through the systems a little bit, or some of them. The integumentary system is the first one we will study. It basically just has the skin, the hair, the sweat glands, and the nails as the only organs in it. It is very important for us, protecting us against environmental hazards, regulating our body temperature, allows us to sweat, and it provides sensory information. Without our skin, we couldn't touch things and feel them because the skin contains a lot of nerve endings as well. The skeletal system is the bones, cartilages, ligaments, and the bone marrow. We will learn about that following the skin. Obviously, it provides support and protection for us. If we didn't have bones, we would be blobs of tissue on the ground, unable to move. Bones also store calcium for us and other minerals, and it forms blood cells. The muscular system we'll study next involves all the skeletal muscles and the associated tendons, allows us to move, protects us, not only because of the thickness of the muscles, but it also can generate heat when our temperature starts to go down by shivering. Let's talk about a term called homeostasis. It's important that you understand homeostasis because most of the systems of the body deal with keeping things the same, keeping things homeostatic so that we can function. And the system I choose to talk about when we talk about homeostasis is our body temperature. And the reason that maintaining our body temperature is so important is because all the chemicals in our body and all the enzymes and all the chemical reactions that occur within our body only occur well at 98.6. And as you start to run a fever and your temperature goes up a little bit, you know how lousy you feel. But the reason you feel lousy is because all of those systems, all those all of those chemical processes don't work as well. And so there's buildup of different waste products, and we just don't do as well. And if our temperature goes down, it's the same thing. Every time you read in the paper about these hikers or climbers on Mount Hood dying, it's always because they got hypothermic, and as they became hypothermic, they weren't thinking very well, And as they got cold and they didn't think very well, they usually took the wrong route down the mountain. They took a misstep, they slid off and ended up down in the bottom of some crevasse 1,500 feet below them. So homeostasis is very important, and our body works very hard to maintain us right at the same temperature virtually all the time. Now, how does this work? How do we maintain homeostasis? Well, we do it either intrinsically, it's just automatic responses in a cell to some environmental change. For example, if the cell has too much sodium in it, it throws the sodium out. If the cell needs more water in it, more water comes in, usually through osmosis. But those are intrinsic changes that just sort of occur automatically. The most important ones, and the ones we're going to study a lot, are extrinsic regulation. And these are usually controlled by the nervous system or the endocrine system. The nervous system is a very rapid response system that allows us to correct things. If we put our finger on something that's hot, we pull our finger back right away in order to protect our finger. If we're starting to grow up and reaching the age of puberty, then our endocrine system starts releasing hormones, and we develop our secondary sexual characteristics, secondary sexual characteristics, and things start working so that we could reproduce ourselves at a certain time in life, which is way too young, as I've learned with a 13-year-old granddaughter. Anyway, most homeostatic systems contain several things, and you need to understand what these words mean: receptor, control center, and effector. In other words, the receptor senses the stimulus, and the control center processes that sense and decides what to do about it, and it sends out instructions. In most cases, that control center is our brain. Even the most mundane functions in our body are controlled by our brain, maybe the lower levels of our brain, but nonetheless the brain. Effectors are things that carry out the instructions. So if our temperature was too low and we needed to shiver, we send signals down from the brain to the muscles, and it fires off things that make the muscles shiver in order to generate more heat to warm us back up. Now, here in our classroom, we have a system that maintains homeostasis for us. And that's why the room stays at about 72 degrees all the time. And it's because we have that little box over there on the wall called a thermostat. And as the thermostat gets too high and the room gets too warm, that receptor, that thermometer, which you see up at the top, sends a message through the thermostat up to the, which is where the control system is, and it says, whoa, the room's getting too hot, and it reads that, and it sends an electrical pulse up to the effector, which is the air conditioner unit, which sits up on the roof. And it turns the air conditioner unit on, and it starts generating cool air, and the cool air is sent down here by the ducts, and it restores the room temperature to normal. As the room temperature becomes normal, that new air goes to the receptor, the thermometer on the wall, and eventually it says, hey, it's cool enough in here, and it turns the air conditioner off. Well, eventually the room's going to get hot again, and so it's going to turn off and on, but it's going to keep that temperature in a very narrow range, what we would think of as a normal range. And the same thing works in our body. Now, just so you know, our body really only works within about a 1 degree variation up or down. So between 98.6, when we get down to 97.6, we're starting to feel pretty chilly. When our body temperature gets up a degree, even to 99.6 or right at 100, we're starting to feel ill. We're starting to feel warm. We're probably starting to sweat, and we're going to feel that we have a fever. So this is called negative feedback. In other words, as we warm, the effector does just the opposite in order to negate the stimulus. I think that makes sense. A normal range is achieved. It's an up and down sort of thing. But just so you know, in addition to a negative feedback system, we have several systems in our body that work on a positive feedback system. And a positive feedback system means the worse it gets, the worse it makes it. I think that's one way to think of it. But basically, the best example of this is I kind of skipped over this, I'm sorry. This is an example of how the body maintains temperature just like the thermostat did. The thermostat center in our brain is found in our hypothalamus, which is illustrated there in that control center picture. And it sends signals out to different things, different effectors like our sweat glands and also our blood vessels to determine how much blood we want to percolate by our skin. You know, if it's a real hot day, our skin looks red. That's because we're putting a lot of blood out right near the skin so that that blood can act like a radiator. The skin can act like a radiator and we can give off that heat. By the same token, if you're up skiing and you don't have a face mask on and your face is getting cold, it's probably going to look very pale. You're not going to be sending a lot of blood to your face, to the skin of your face, because you know that if you do send blood there, it's going to carry heat with it, and that heat is going to be dissipated off into the environment, and your body temperature is eventually going to go down. So the blood vessels have a great deal to do with how we maintain our temperature. It doesn't include it here, but it could include the muscles that shiver, as I mentioned before, as well. So that's one example of negative feedback. The positive feedback example, which is I don't think a very good one, but yet there's several of them in the body, which means that the response of the effector increases change of the stimulus. And the best example I can give you that, this is made to speed up the process, is if we cut ourselves. So if we cut ourselves and we get a break in the blood vessel, then the blood leaks out into our tissues and it stimulates the creation. There's damaged cells there, and they send the messages out to the body that say, hey, we need a clot here. We need a lot of clotting factors. And so that causes additional chemicals to be released that make our blood clot. The more chemicals are released, the more they release. And it's a kind of a positive loop. And the more we bleed, the more clotting materials we excrete out into the system so that we clot better. And that's a positive feedback loop that you see in this diagram here. Well, eventually, we hope the bleeding is going to stop. And when it does, we're going to stop making all the clotting factors, and eventually the clot is going to be reabsorbed, and we're going to come back to normal. But for a while we're needing all those factors, we are releasing them like crazy in that positive feedback loop. Systems integration is something we're going to talk about because these systems don't operate together. And I've already mentioned that one with the skin and the blood vessels. Well, the skin is one system. And yeah, the skin can sweat to make us cooler, but the cardiovascular system, the blood vessels, control that heat exchange system of the blood going past the skin. So keep that in mind and realize that's a typical example of more than one system working together to accomplish the homeostasis. Now, this is a real complicated slide, and I don't expect you to know everything on it, but just as an example, look at the top one up there entitled Body Temperature. And in order to control our body temperature, we really use four systems: the integumentary system, or the skin, which is where we can mainly get rid of heat; the muscular system, which can make heat in the form of shivering; the cardiovascular system, which is going to decide where all the blood goes, and it's either going to send more blood to the skin to get rid of heat, or it's going to send less blood to the skin so that we hold on to our heat. And then, of course, the nervous system. The nerves are what's going to actually control all of that. The nerves are going to go to the blood vessels and say either expand or shrink up and help you control that flow of blood. So right there in one little process called body temperature, you see there's four major organ systems involved. And that's kind of the way the body works all the way around. All right, if we're going to talk about anatomy, we've got to have a starting point. We've got to know what's up and what's down and so forth. So we have to start with what's called the anatomic position. So if you stand up, put your heels together, turn your toes out a little bit, but basically pointing forward, and then stand with your palms facing forward. You have to have your palms facing forward for this to make sense, and we'll talk more about that in a second. Two positions you need to know about. They need to know the name of one is called supine. Supine means laying on your back, like you might lay in bed looking at the ceiling. That would be the supine position. Prone position is when you lay on your tummy, face down. You're still in the anatomic position. In other words, your hands are still down at your side and your hands are still facing forward if we're going to talk about anatomic orientation of this sort of stuff. Today we're going to talk about anatomic landmarks. That's reference to palpable structures. Palpable means feelable. And I think you can't learn anatomy. And I don't mean to be coy here or anything, but just tell you that you need to touch yourself. You need to put your hands on your bones and you need to feel things. You need to feel muscles. And as we go through all of this stuff, if you want to do that in the privacy of your own home, that's fine. But I know oftentimes I will look around the room and there'll be a lot of folks out there touching their neck or their shoulder or their arm and so forth in order to try to help themselves identify these anatomic things we're going to be talking about. We're going to talk about body regions and abdominopelvic regions and anatomic directions. Let's just go through them here. These are regions of the body that are superficial, that you can see and feel. And so the forehead is referred to as the frons, the frontal area. Those are words that we'll come back to many times. There'll be frontal nerves, there'll be frontal muscles, there'll be frontal bones, and so forth. The nasus, or the the nose refers to the nose. The oculus is your eye, also referred to the orbit. The orbit is the big socket that your eyeball fits in, or the ocular area. And so if you have medicine drops in your medicine cabinet at home and it says ophthalmic drops or ocular drops, those go in your eye. If they say otic drops, otic refers to the ear, also called your oris. It's what you hear with. Buccal refers to your cheek. We have buccal nerves, we have buccal muscles, and so forth. These words do become very obvious to you as we go on through this course. Your neck refers to your cervix. Your cervical vertebrae live in there. There's cervical arteries, there's cervical muscles, and so forth. Your cervical vertebrae all live there. So that's the cervixes. Now there are other cervixes in the body, but don't be confused. This is the cervical region. Your chest is referred to as your thorax, thoracic cavity, or your chest. The mamma or mammary gland is why we're called mammals. It's because we nourish our young after birth. Abdomen is the abdominal area, involves your entire belly. The center of your belly, so to speak, is the umbilicus, or your belly button, or your navel. That's where the umbilical cord used to attach. That all forms the trunk. The trunk kind of goes from shoulders to hips. Over here on the other side, the head is referred to as the cranium or the skull, the cranial area. The face, obviously, the facial area is your face. Oris is referred to is your mouth. Now, you've heard it called the oral cavity before for sure, but just know that sometimes there's orbicularis oris. There's different muscles that are named oris, which is really referring to oral once again. The mentis is your chin, the mental area. And the only way I know to help you remember this is I always think of that statue by Rodin of the thinker, where he's thinking and he's using his mental facilities and he's bending over and he's got his fist on his chin, his mental area. But anyway, that's just to help you remember it. The armpit is referred to as the axilla. We'll talk about axillary arteries and nerves and axillary lymph nodes that live all in the armpit. The arm is called this is the arm that goes down to your elbow, and that's called the brachium. And then the forearm is called the antebrachium. Excuse me, that's not right. This is called the forearm. The antecubital area is referring to the front of your elbow. That's where blood gets drawn out of the antecubital vein, and so the front of your elbow is referred to as the antecubital area. Going on down the body, the antebrachium is referred to as the forearm. It goes from your elbow down to your wrist. Your wrist is called your carpus, or the carpal area. You've probably all heard of carpal tunnel syndrome. Refers to problems in your wrist right there. The palm of your hand is referred to as the palmar surface, and the big thumb is called the pollex. And indeed, we have a number of muscles that attach to our thumb that make our thumb able to do the amazing things that it can do. And I don't know if you've thanked your thumb lately, but I can assure you that your thumb is very valuable to you. It's the fact that our thumb can oppose, in other words, it can touch all of our other fingers and allows us to manipulate very small things very delicately and under great control, is one of the major things that has led to humans advancing well beyond all the other species. The fingers are referred to as the phalanges. You'll notice on this diagram that the toes are also referred to as phalanges. The front of the knee is referred to as the kneecap or the patella. The foreleg, which isn't called the foreleg, it's called the leg. It's called the crus or the leg. Now, just let me stop for a minute and make the point that our arm is down to the elbow, and then our forearm goes forward to that. But it doesn't work the same with the leg, because if that was the case, the leg would be the upper part and the foreleg would be the lower part. But that's not right. The thigh, or the femoral area where the femur lives, the biggest bone in your body, runs through your thigh. That's called the thigh, or the femoral area. The lower part of your leg is called the leg. So just remember that the leg is the lower part of your lower extremity, and your arm is the upper part of your upper extremity. It doesn't seem like it would be that tough, does it? Anyway, whereas the carpal area was the wrist, the tarsal area is the ankle. So there's a bunch of tarsal bones in there we'll get to later. The phalanges. Whereas the big thumb is called the pollex, the big toe is called the hallux. And believe me, I will want to kick you with my hallux if you don't learn your A&P the way you should. So the hallux is the big toe. My name is Hal, by the way. That's my study aid there. The pes is often referred to as the foot, a pedal area. This is where pediatrics, the word pediatrics came from. Little kids running around underfoot. Pediatrics came from that word right there. Up in the lower abdomen is the pelvis. The groin on either side is referred to as the inguinal area. We have inguinal hernias, inguinal nerves, and so forth. We have the pubic bone, which is the front part of the pelvic bone. The pubis is the pubic area. Femoral, as I said already, is the thigh, basically. On the back side, we've got the head called the cephalon. The cephalic is the direction towards the head. Cervicis, once again, is the neck. The acromion is the point of your shoulder. So if you put your hand out there and feel the point of your shoulder, that's the acromion, which we're going to learn shortly is actually a sticky-uppy thing on the scapula, the shoulder blade back here. The dorsum is the backside of your body. The ventral surface is the front. We also call the dorsal surface the posterior surface of our body, and the ventral surface in front we call the anterior surface of our body. The olecranon is the point of your elbow. When you put your elbows on the table, you're resting your hand on your olecranon. Your olecranon is a piece of the big bone in your forearm called the ulna. So coming down the backside, the lumbar area is the lower part of your back. We have 5 lumbar vertebrae, which we'll talk about. We have butts called buttocks or gluteus. All the gluteal muscles, gluteus maximus, gluteus minimus, gluteus medius, they all live in there. The popliteal area is the name of the back of your knee. Now remember, the patellar area is the front of your knee. The popliteal area is the back. You get popliteal aneurysms, you get popliteal arteries, you get popliteal nerves, popliteal muscles. They all live back in there. So these regions, learning them right up front makes a lot of the naming later make a lot more sense. The sura, or the calf, refers to the calf. There's a sural nerve that runs down there and innervates that whole part of your body. The calcaneus is your heel bone, and coming up from the calcaneus is the calcaneal tendon. The other name for the calcaneal tendon is the Achilles tendon, and you remember that Achilles' mother dipped him in the river Styx, holding him by his Achilles tendon, which is the only part that didn't get coated and therefore was his weak spot. He has an Achilles heel. That's where that term comes from. The bottom surface of the foot is called the plantar surface. Just like the front of the palm is called the palmar surface, the bottom of the foot is called the plantar surface. So there's big lists of these in your book. I think we've been over them. Let's talk about the divisions of the abdomen. There's 2 ways to do it, and this is the way we always did it in surgery and in the medical record, was recorded things as either being in the right upper quadrant, the left upper quadrant, right lower quadrant, or left lower quadrant. And we just used the letters. So if people had right lower quadrant pain, we were always concerned that they might have appendicitis. If they had right upper quadrant pain, we were always concerned that they might have troubles with their gallbladder. And left lower quadrant pain was oftentimes diverticulitis of their sigmoid colon. But anyway, that's the quadrant technique. The book uses this tic-tac-toe board on the abdomen. I think it's reasonable. Let me just explain the words to you. First of all, start in the middle, the center square, the umbilical region, the umbilicus, where the belly button used to attach, where the umbilical cord used to attach. Below that is called the hypogastric, or the pubic region. Above that is called the epigastric region, sort of above the stomach region. The 2 sides are called the hypochondriac areas, the right and left hypochondriac region. And why is that? Well, I always thought hypochondriac meant somebody who was faking their disease. They were a hypochondriac, and that may be true, but the reason it gets that name is hypo means below, and chondriac, or chondro, refers to cartilage. And if you look at one of our skeleton men in the lab, you'll see that there's a whole bunch of cartilage along the lower edge of the ribs there that connect the bottom ends of the ribs together. And so that's called the hypochondriac area, because it's below all that cartilage. The lumbar areas are out to either side, right lumbar, left lumbar, and then the inguinal or groin regions are down on either side. You got different organs living in here. I think the thing you always have to remember is there's very little in the abdomen that doesn't move around. The gallbladder pretty much always lives up here in this part, in the right upper quadrant of the abdomen. The spleen pretty much always lives up here in the left upper quadrant. The sigmoid colon pretty much lives down here in the left lower quadrant, and the appendix pretty much lives in the right lower quadrant, although it can extend and be way up here or way down here in the pelvis. So those, you got to be a little careful when you're dealing with the abdomen, and remember that the organs can move around a fair amount. Anatomic terminology, this slide doesn't have a naming on it like it probably should, but just remember that up is superior and down is inferior. Up is also referred to as cephalic, and down is referred to as caudal. Now, caudal really means towards the tail. So I don't really think caudal has much role below the waist, because really our tail is just below our waist there. But nonetheless, that's a fine point. Anterior is anterior, posterior is posterior, ventral is in front, you could put that word in there, and dorsal is in back. Here's some other directions, right and left. Whenever we call anything right and left, we're always referring to the patient's right and left. So when we look at an x-ray, for example, we always look at the x-ray with the patient looking at us, but nonetheless, when we talk right and left, we still use what is the patient's right. So the patient's right is on the left from our point of view when we're looking at an x-ray. So just keep that in mind. Superior is up, inferior is down. Proximal and distal are basically directional terms that really only work on the extremities. So the fingers are distal to the elbow. The shoulder is proximal to the elbow, and so forth. Same with the lower extremity. We don't use proximal and distal on the rest of the body very much. Medial means towards the midline. Lateral means away from the midline. That's easy enough. So here's all these words. I'm going to just leave it like that. Let's talk about the planes of the body. You guys remember from your geometry that a point is a point, 2 points make up a line, and 3 points make up a plane. And so we use planes a lot in medicine, and the reason for that is that x-rays create pictures that are a plane. CAT scans certainly make pictures that are a plane, and so forth. We use a lot of sections, which are slices in the body, and they're usually parallel with one of the major planes. So these are really important in terms of MRIs, which is magnetic resonance imaging. It's where we make pictures from magnetic waves. Positrons, PET, PET scans are the newest thing. CT scans is computed technology, computer. I'm blocking a word there. I'll get back to it. Just so you know, CT scans, this was a shock to me. When I was an intern, this was in 74, I had a patient. I was on the neurosurgery service, and the attending doctor said, Sessions, would you take that patient across the street to the NIH, the National Institute of Health, which is right across the street from Bethesda Naval Hospital where I was working. They said, would you take him over there and get a CAT scan on him? And it's called computer-assisted tomography, or computerized tomography, which means planes, by the way. I remember the word. So I loaded this guy up. He was a Vietnam guy who'd been shot in the head and was not thinking real well. And took him across the street in an ambulance with a nurse and a corpsman or so. And we put him in this CAT scanner. Now, I'd never seen a CAT scanner before. We didn't have one at our hospital yet. And I was sitting there talking to the people. And all we could do was a head scan in those days. CAT scans started with heads only, and they kind of fit his head up into this machine. And I think we took 4 slices through his brain, and it took about 3 hours to do it. These days, it takes about 10 seconds to do a CT scan from the top of your head to the bottom of your toes, and it creates a slice every 2 millimeters. So it creates literally hundreds of slices in a matter of seconds. And they're so much better quality than they used to be. But anyway, so I was sitting over there, and I said to one of the technicians, I said, wow, this is amazing. And they said, how many of these do you have? He says, oh, we have 9 of them over here at this is, of course, the major research hospital in America. And they had 9 of them. 8 of them were only big enough for monkeys, and only 1 of them was big enough for humans. because a lot of their research, of course, was done on animals over there. Anyway, I noticed the name on the side of the machine was called an EMI scanner, EMI, and I thought, well, that's interesting. What does that mean? And I asked one of the guys, and they said, oh, yeah, that's the company that makes these things. You may know it better as Apple Records. Basically, it's the Beatles. The Beatles bought a company when they were in their early stages, when they had tons of money, obviously. And they bought this company called Electronic Music Incorporated. And they did that in order to synthesize all the music that they were doing. But as a spin-off of that, they developed this concept of running x-rays through folks and then processing them through that same computer and coming out with pictures. So the original CAT scanners were called EMI scanners, and they were a product of John, Paul, George, and Ringo. That's kind of cool, isn't it? So here's the planes we're talking about. The one we've already seen, that x-ray I showed you, is a frontal plane picture. It's a plane that runs down through your ears and down through your shoulders and up and down like that. Obviously, there's lots of frontal planes that move forward, and there's frontal planes that move backwards from that. A sagittal plane, the true mid-sagittal plane, is the plane that goes right down through the very middle of you and divides you into a right half and a left half. There are lots of parasagittal planes as well that come into play there. And then over here in the this quadrant, you see there's the transverse plane, which are the transverse cuts. So we use these planes in a lot. I think you also need to know that there's another plane called the coronal plane. The coronal plane is used in the head only. So the coronal plane views of the skull and the brain are the ones that are same as the frontal plane, but they go up and they go through the brain. That word derives from the crown. The king's crown had a big thing up and down on the front. That's where the term coronal plane comes from. Okay, I think we will stop here and pick that up tomorrow. Just 10 slides left to go. I may even double back a little bit. So that's the end of our first lecture in 231 on Chapter 1. We got mostly through it, and we'll go from there tomorrow. Have a great day. Let's go to lab.